My name is Bimal Ashar. I am an associate professor in the Department of Internal Medicine at Johns Hopkins. I'm the clinical director of the Division of General Internal Medicine. I'm also the director of the Advanced Medicine Clerkship, which is the medicine sub-internship at Hopkins. Our book is a very thorough book, in my opinion. The authors are all Johns Hopkins faculty. They have extreme expertise in their areas, and we've chosen them very carefully on what they're authoring. Now, that being said, that gave us a lot of work to do in editing the book, because we needed to take out a lot of the stuff that specialists would really be drawn to, rather than what a generalist might need to know. I think our book is different in the fact that it can serve as a very good general reference in addition to being a board review book. I use it more in my day-to-day clinical activity than I actually thought I would be. The other thing I like about the book, there are two things. The one thing that we really set out to do from the get-go with this book, and with this edition specifically, is to have very good figures to help tell the story, and to have diagrams and algorithms in the book. I think we do a very good job with that, and that was one place where we thought that some of the existing texts lacked. The other thing is just it's a resource, one that you can go back to over and over again, and it's not just going to be something where you study for boards and it goes away. And the bank of 1,000+ questions that Elsevier has put online, I think are very good questions. Boards have changed because, especially internal medicine boards, because there's so many more things to cover than there used to be. There's so much more knowledge than there used to be, and internal medicine boards is covering so much more than it used to cover. And now, as I mentioned earlier, we're talking about cost-conscious care. Now, this is a big push from the people who make the boards, the American Board of Internal Medicine. It's a big push from the American College of Physicians, and so physicians need to all of a sudden be aware of cost-conscious issues when they're approaching the boards. The areas of genetics is also one that's going to start to come up. Areas of complementary alternative medicine, we've already seen some aspects of that get into the board review questions. And so all these will continue to expand, and as other fields, for instance, palliative care is now an accepted field, there are going to be questions about that on the boards. And so I think the difficult part for an internist is to try to stay on top of all of this, and it's very, very hard, and it's challenging, and that's why you see a lot of subspecialists not recertifying in general internal medicine anymore. I think it's probably harder to recertify than it is to take it the first time, because the first time most people who are taking it are fresh out of their residency and have had a lot of teaching on the inpatient side and the outpatient side, which hopefully translates into knowledge when they're taking the boards. As opposed to when people have been practicing for almost 10 years. We think that the boards are supposed to cover everything we do in practice, but the boards cover a whole lot more than that. There are questions on the boards that are some more obscure diseases that we love to have in our differential diagnoses, but many of us will never see in our lifetimes. There's also issues that some people may have geographically that others never see. So, for instance, some diseases that occur in the Northeast that someone who's practicing in California may never see, and vice versa. And so the recertification may be a lot more difficult from that respect, because it may not completely mirror what your training was.